Hello everyone, let's get started. What is the first picture that you see here? This is a sagittal MRI, T1, T2. Yes, we can see. We can see that the white matter is white, the grey matter is grey, and the CSF is dark. So this is a T1 sagittal. Let's focus on the image. What can we see here? This is the cerebrum and this is the cerebellum. Have you seen something? What is this point known as and what is this point known as? So this entire bone that you see here, this bone and this bone, this is the occiput, and this opening is the foramen magnum. Now, on the anterior margin of the foramen magnum, we have this median point which is termed as the basion, and on the posterior margin of the foramen magnum, its median point is known as opistheon, and a line connecting both the basion with the opistheon. This line is the Macrae's line. Normally, the tip of the cerebellum, that is cerebellar tonsils, should be above this Macrae's line. Max to max, sometimes there is congenital displacements or ectopic cerebellar tonsils. In that case, up to 3 to 5 mm, it's still okay. But in a condition where, number one, the tonsils are displaced inferiorly by more than 5 mm, as in this case, and that too bilateral, and the tonsils are no more rounded, instead they are pointed and is known as the typical peg-shaped. When nothing else is mentioned, we know only these points, then we will say that this is a Chiari 1 malformation. So our answer here is going to be a Chiari 1. So what are the findings we will get in a Chiari 1 malformation? There will be herniation of both the cerebellar tonsils but not the vermis, and the displacement is more than or equals to 5 millimeters. There may be presence of syrinx. Syrinx is any collection of fluid within the medullary cavity, and these tonsils, they herniate down through the foramen magnum. And because of this herniation, there is kinking at the cervicomedullary junction, that is the region where the medulla is now finally becoming the spinal cord. Okay. Additionally, so there can be presence of syrinx, there can be cervicomedullary junction kinking, elongation of the fourth ventricle. Fourth ventricle may get elongated, and I already told you the tonsils will be peg-like. However, very important is, if you are diagnosing the thing as Chiari 1 malformation, there should be no myelomeningocele. A close DD that we can have are low-lying tonsils or benign tonsillar ectopia, where the descent is less than 5 mm. Also here the tonsils have not become pointed or peg-like. They will be rounded. Here there is a diagram, schematic diagram, that shows the Macrae's line here, and this is the herniation that you can see, which should be more than or equals to 5 mm. Right?